Hi guys, today I'll be talking about a cracked tooth. Unfortunately for this tooth, it was cracked to the extent that it needed root canal treatment. So the root canal treatment has already been completed by the endodontist, and what he did was to place a little metal band around the tooth to just stabilize the tooth before the patient had time to place a crown on it. So this was how it looked like when I first saw the tooth. My discussion with this patient was quite straightforward. We know we needed to place something on the tooth to protect it from further damage, especially since root canal treatment has already been done, and this usually makes the tooth a little bit more fragile. But it also mattered to me what kind of ceramic restoration we want to put on the tooth. Traditionally, we will want to place a crown that envelopes the entire tooth, 360 degrees, but I talked to the patient and we decided to do something a bit more conservative. The reason being the tooth was already cracked, so it's already structurally compromised, and we want to try our best to keep as much healthy tooth structure as possible so that in the event of a failure, the tooth is still restorable. So this is in line with the thinking that anything that we do on your teeth will fail eventually. So we want to plan for failure of the restoration, and we want to have a situation where when that happens, the underlying tooth is still really good, and we have a lot of options moving forward, and not end up with a situation where the only way out is to remove the tooth, right? So because the tooth was cracked, so we wanted to place something strong on the tooth, but not trim too much tooth structure away. So something that's kind of new in the scene is Zirconia onlays. So traditionally, zirconia cannot be bonded to tooth structure. It needed that retention form that we get when we trim the tooth circumferentially all over. That helps to retain the crown. Currently, with new techniques, we can leverage on bonding to place a zirconia onlay. Onlay is something that's non-retentive. It's really relying on the adhesion between the zirconia and the tooth for it to stay in place. Okay, so I'm going to show you some photos that I took along the way. Alright, so I have done some initial preparation. We've shortened the tooth by approximately 1.5 millimeters to make space for the zirconia that's going to be on top of the tooth eventually. And what you really see here is the underlying cracks, right? So I'm just going to circle them out for you. Alright, so you can see one over here, and if you look really closely, there's another one right over here. Okay, so there are a few things we can do at this point. We can just leave the cracks like they are currently and just continue with what we need to do and place the zirconia only on the tooth. Or we could do something that could help the tooth a little bit more, okay? And this is really just removing the cracks as much as we can. So this is a process called crack dissection. This is where we treat cracks like decay, so they're not meant to be on the tooth. As much as possible, if we can, we want to try to remove them so that we reduce the chance of them progressing. Okay, bearing in mind that this is a cracked tooth, so with a cracked tooth, the prognosis of the tooth is always going to be guarded. What we are trying to do here is to throw everything we can at the tooth to restore the tooth to as close as it used to be, right? So here you can see that I've already removed some cracks over here where you saw the photo, where you saw the cracks were on the photo earlier, and over here as well. If you look really closely, you can still see a thin white line. I'm just going to overlay it with the red pen. And this is where I decided to stop the crack dissection. I've removed it to the point where I felt was enough. Okay, so what I'm going to do next is to fill up these little holes that had to be created to remove the cracks. And we're going to fill them up. Okay, so this is just another angle of the crack on the side there. Okay. Alright, so this is on the day of delivery. I just want to show you that we have already restored the areas that were cracked. You can see it over here. I'm just going to draw the areas out again. Right, so here and here, this is where the cracks used to be. So I filled up the cavities that were created to remove the cracks with a short fiber reinforced composite. That's going to really help mimic this portion of the tooth. So what we're also trying to do when we restore a tooth is also to restore like for like. So with enamel, which is the outer layer of the tooth, that's a really strong kind of substrate. So we want to place ceramic on the outer layer that's going to be as close as the enamel that we have in our teeth. So the inner layer of our teeth is dentine. We want to try to use composite resin to restore these areas. So that is what I did instead of covering those areas with ceramic. Alright, so like I mentioned, this is on the day of the delivery. The zirconia onlay is going to go onto the tooth now. So we really want to try to make sure the area is really clean, dry, well isolated to prevent any contamination with moisture, because bonding is a really sensitive process and we want to make sure we get this right. Okay, so we have already sandblasted the tooth. It's really clean now, frosty, looks nice. So I've employed some additional measures to make sure that when I'm bonding the zirconia onlay, that there is absolutely no contamination with moisture whatsoever. And I've also done all these things to increase the ease of removing the excess cement that will invariably extrude from the sides of the tooth. So I'm just going to annotate a little bit again. Yep, alright, so we've got Teflon tape to cover the adjacent teeth here so the excess cement doesn't get onto the tooth. Not that it can't, we can clean it up. Another one over here because we don't want the cement to flow to underneath the bulbosity of the tooth, and over here as well, right? Okay, great. Alright, so this is as much as I can show. I think that this really illustrates how much restorative dentistry has advanced over the years, that we are really trying to do our best for our patients and give them the best options available. Yeah, that's all I have for today. Alright, bye!